Dini, and the Deputy Chairperson of the Health Service Commission, Dr. Rugare Kangwende, and all the commissioners of the Health Service Commission present, Secretary for the Health Service Commission, Dr. Pasi, and the Acting Secretary for Health and Childcare, Dr. Nyamayaro, senior government officials in our midst, and most distinguished representatives of all the development partners that have, are, and continue to be part of this transformational journey in the health sector, constituting a very significant and critical sector to drive national development of the country towards an upper middle income society, and I want to add economy by 2030. I would want to recognize you all. It is an honor to address you today as we witness very significant milestones that right from the onset included a very key phase of analysis for purposes of clearly delineating the nature of the mischiefs that afflict and continue to afflict our health sector, and then moved on to the stage or the phase of policy articulation, and from there to strategy development, and today the onset of programmable, actionable, strategic interventions captured in the Zimbabwe Health Workforce Investment Compact for 2024 to 2026. As the Health Service Commission, we are excited to be part of this ongoing collaborative work as we transition, if you like, from analysis to action. On the 10th of September this year, Cabinet approved the Health Workforce Strategy. The documents have been shared with me, and I hope they are also on your tables, and also the Investment Compact, marking a turning point in our collective quest to enhance Zimbabwe's healthcare system. These efforts represent a national resolve to address the gaps and challenges in our health workforce, with the ultimate goal of improving health outcomes and contributing to the attainment of Vision 2030. I think it is common cause that a resilient health system rests on the shoulders of a well-trained, adequately resourced and motivated health workforce. And our health workers are the backbone of such a system, ensuring that essential services reach every corner of our country. However, we have long acknowledged the challenges they face, ranging from inadequate staffing levels and skills gaps to resource constraints and a challenging working environment. With the health workforce currently at 47.5% of its optimal capacity, and the ongoing outward migration referenced by the Honorable Minister for Health and Childcare, these interventions become the more necessary and timely and crucial. The Health Workforce Strategy for 2023 to 2030 and its corresponding investment compact are responses to these realities. They are a testament to our unwavering commitment to building a robust, well-supported health workforce that can deliver equitable, high-quality health care for all Zimbabweans. Our vision, thus, is to have a health workforce that is adequate in terms of numbers, diversified in terms of skills, and motivated to deliver quality health services for all Zimbabweans. And to achieve this, we have prioritized 5 strategic thematic areas, namely health workforce education, training and development, health workforce deployment, utilization and governance. Third, health workforce retention and migration management, health workforce monitoring and evaluation, information communication technologies, research and innovation. And last, health workforce planning and financing. The Health Workforce Investment Compact for 2024 to 2026 serves as a blueprint for targeted, impactful investments in the health sector. And the Health Service Commission, in collaboration with all of you, has further outlined specific commitments that will drive our efforts forward. The first is scaling up recruitment and retention. As the Health Service Commission, we commit to scaling up the recruitment of health workers to close the staffing gaps that have long hindered our service delivery. And a special focus will be placed on underdeserved and rural areas, ensuring that all Zimbabweans have access to quality health care. The second area of focus is enhancing training and capacity building. We recognize the need to continuously build the capacity of our health workforce. As part of this compact, we are thus prioritizing investments in training and development programs that equip our workforce with the skills needed to respond to emerging health challenges. This includes adopting innovative training methods and leveraging technology to upskill our workers. Third area of focus is improving working conditions. The Commission is committed to advocating for improved working conditions across the health sector. And this entails not only better remuneration and incentives for our health workers, but also ensuring that they operate in safe, well-resourced environments conducive to delivering high-quality care. The fourth area is strengthening workforce data systems. In order to make informed decisions, it is critical that we have reliable data on our health workforce. Through this compact, we aim to strengthen workforce information systems to enable better planning, monitoring, and management of our health resources. And fifth area of focus is promoting health worker well-being. The well-being of our health workers is paramount. We are investing in comprehensive wellness programs that support both the physical and mental health of our workforce. And this includes access to counseling services, stress management initiatives, and creating a supportive work environment. We are committed to doubling our current health workforce by 2030, creating and sustaining at least 32,000 additional jobs in the health sector, and reducing health workforce attrition by 50% through appropriate training, attraction, and retention measures. This will require substantial investments, including our health workforce recurrent cost and investments from the current $9 per capita to at least $32 per capita by 2026. And the metric in our comparator countries in this regard stands at $24 per capita. The government of Zimbabwe, in collaboration with our partners, has identified key areas for critical investment to transform our health workforce. And between 2024 and 2026, we need an investment of $1.63 billion to jumpstart this crucial journey, in addition to the government's current spending on human resource for health. An extra $475 million is needed to achieve the goals set out in the investment compact for the years 2024 to 2026. As the Health Service Commission, we are not only endorsing this compact, we are taking active steps to ensure its successful implementation. And our contribution includes working closely with the Ministry of Health and Child Care to align recruitment strategies with national health priorities. Secondly, supporting the review and modernization of training curricula to reflect the evolving health landscape. Thirdly, facilitating dialogue with various stakeholders, including development partners, to ensure that the necessary financial and technical resources are mobilized for workforce development. Fourth, leading initiatives that promote transparency and accountability in health workforce management, ensuring that every dollar invested yields tangible improvements in service delivery. We must address the key question: what is the Health Service Commission? What is it, I beg your pardon, that the Health Service Commission committed to doing to support the outcomes driven by the initiative that brings us together today? The answer is clear, that by creating 32,000 public health jobs by 2030, we can potentially stimulate an additional 100,000 jobs in the broader economy. These posts with Treasury concurrence will be progressively funded and filled as outlined in our health resource strategy. Between 2024 and 2026, a total of 14,069 funded posts will be created, with 88%, that is 12,308 of them, allocated to hiring additional health workers from the education pipeline. Specifically, 4,430 posts will be funded in 2024, 4,098 in 2025, and 5,541 in 2026. Additionally, 12% of those posts, that represents a figure of 1,688 posts, averaging 563 per year, will be dedicated to transitioning health workers currently funded by the Compact signatory partners. Within 3 months of the Compact start, the Health Service Commission, working together with the Ministry of Health and Child Care and signatory partners, will jointly map and evaluate donor-funded positions. And based on these findings, a transition plan will be developed to move these positions to the government payroll. Following the Compact's implementation, signatory partners will adopt the government-approved salary harmonization framework to ensure uniform pay, and facilitate a smooth transition to the government payroll. The Health Service Commission will regularly monitor staffing levels in all health facilities and provide an annual report on vacancies, attrition, and replenishments during the annual HRIH investment dialogues. And this we would want to schedule as part and parcel of our annual operational plans. The Health Service Commission will establish a plan for government grants to progressively remunerate village health workers, ensuring wage harmonization across compact partners, starting at $20 per month and increasing to $50 per month by 2030. The Health Workforce Strategy 2023-2030 sets out a long-term vision for Zimbabwe's health workforce, anchored in the aspirations of Vision 2030. It seeks to transform our health system into one that is resilient, equitable, and capable of responding to both current and future challenges. As we embark on this transformative journey, it is critical that we remain united in purpose and action. I want to extend, on behalf of the Health Service Commission, our gratitude to our partners, both local and international, whose support has been and will continue to be crucial in achieving our goals. The partnerships we are cementing today will play a pivotal role in ensuring that we build a health workforce that is not only fit for purpose, but also sustainable for the future. In conclusion, I call upon all stakeholders here today, government, development partners, private sector, civil society, to continue working collaboratively towards realizing the objectives of the health workforce strategy and the investment compact. Together, we can transform Zimbabwe's health sector and deliver on the promise of Vision 2030 of a healthier and a more prosperous nation. Thank you very much.